And COVID happened. I became our COVID lead physician for our department and subsequently burned out from doing all that work and really dealing with COVID in general. It was very fulfilling, but the patient volume was rising and I just couldn't see myself being able to keep up with that volume and actually treat my patients the way I wanted to, but also be able to balance that with a leadership role. That's about the time when I actually found a physician coach, and they really helped me be the best leader I could be at the time. They helped me realize that I didn't want to lead medicine. I just needed a different way to practice. They gave me the courage to tell my boss that I was burnt out, which was really hard for me because there's just so much. I think I was judging myself for being burnt out, a lot of embarrassment, really trying to manage like what part of this was I responsible for versus the system was responsible for. And ultimately really taking ownership for my part because that's the only thing that I can control. If we're thinking about medicine, and mentorship is usually someone who's finding somebody that's in your field that has similar goals and working with them for advice. And it's very development driven. When we talk about coaching, it's also goal oriented, but very collaborative. It's not necessarily me telling you what to do. It's me showing you that you have the answer.
Welcome to Life as a Patient Doctor. I'm your host, Dr. Stephanie Moss, navigating life as a patient and a medical doctor. Join me as I interview other doctors, students, and healthcare workers on their own journeys. Listen to their unique stories on how they balance their health while caring for others in the health profession. Welcome, everyone. Today, I'll be interviewing a phenomenal physician, Amruti Borad, who is an osteopathic concierge, family medicine physician, primary care physician, and a medical student coach. She was previously in academics and a physician leader. After experiencing burnout and working with a physician coach, she found a new path in medicine and decided to certify as a coach to help primary care physicians and the future of medicine, our medical students, prevent and treat burnout, practice medicine with fulfillment, navigate transitions, and learn to thrive in any environment. At the core, she strives to empower each individual to trust oneself. Thank you so much for joining us today.
Thank you for giving me this opportunity to speak with you and
Ah,
your audience.
I would love to hear a little bit about your background and journey into medicine.
Yeah, of course. I was always someone who loved science. That was a strong suit for me. And I love learning new things. I'm a bit of an introvert, so I'd really like to have these one-on-one, deeper relationships with people. And so putting all those things together, I started to really think about medicine and later on primary care. And neither of my parents were in medicine, but they were both immigrants from India. And for them, it was very important that no matter what we did, me and my sibling, that we were able to take care of ourselves. And that's also where I realized how important financial stability is as well to help you build the life that you want and that you want for others. And so it came time towards the end of high school where I really started thinking about, okay, I'm going to apply to colleges. What major do I want? And medicine was really on my mind. And my parents, they knew that I was this perfectionist, this hyperachiever, and they would force me to go out with my friends. I was that nerd. And so they said, remember, medicine is a long journey and you have to make sure that you want to do this. So why don't you go and meet with other professionals? So they had friends in different professions I met with and I would shadow, and it still just didn't seem right to me. Like medicine was the right fit. I also was not good at standardized exams. I could ace any other type of exam, but standardized exams, it was just like I just couldn't do it. So I decided that I would apply to accelerated programs where you're not required to have the top scores, but you are able to combine college and medical school. You're able to skip a year of college, and then you're able to do internships with the medical school and those sorts of things. So I thought, okay, I'm going to apply to normal college and I'm going to apply to these programs. If I get into a program, it's meant to be. So I ended up getting into 3 programs, and I ended up choosing Pitzer College and Western University of Health Sciences, which is an osteopathic medical school. both in Southern California. And I chose that because one, I actually really liked the people. I loved the school. It was a very small learning environment, but also osteopathic medicine at the time was becoming more mainstream. And I realized I wanted this extra tool in my toolbox to not only have this like whole person approach to medicine, which fits along with primary care, but also being able to treat chronic pain condition in a different way. So I ended up choosing that path. I ended up having essentially contracting into 3 years, which was very difficult. And then starting medical school at a younger age than was the average age for my medical school. So there's a lot of like self doubt and a lot of things that happened in that way. But that was my journey into the field of medicine.
Wow, thank you so much for sharing that. I haven't spoken with anyone who's done an accelerated path like that. And that's really cool that you were
Sure.
able to get into medicine relatively early in age. How did it feel to be in that path? Were all other students similar in that accelerated path, or were you mixed with students who went more traditional path to medicine?
Yeah, it's a good question. So there were three of us that were in the program. And so when you apply, you interview with the college and the medical school, and then they decide who's the right fit for the program. So there were three of us. And then all of our classes, though, were intermingled with the traditional college students. So sometimes it made it hard in the sense of the college that I was a part of, most people were not science majors. So when you're a science major, it's just you're always studying, right? There's just so much to do. And so that part was hard for me. And then there's a lot of doubt. It's everybody else is having fun in college while I'm studying all the time. And why did I decide to compact this into 3 years? A lot of that, but I think my mentors that I had at the time really helped me stay the path. And I'm very happy that I ended up doing it.
Thank you for talking about mentorship. You mentioned that you had mentors. Were those ones that were pre assigned, or how did you go about finding mentors during your journey?
Yeah, for college, they are pre-assigned. It was mentors that are all involved in my specific medical accelerated program. I had one main mentor who really kept me going. No, you can't stop. I know you can do this. You are doing the right thing. And then I had other mentors along the way that were just added from the program. And then in medical school, yes, you're assigned mentors, but what I ended up doing was as I went through medical school and learned which professors I really connected with, those are the people I would reach out to. And at some point in medical school, I think it was my third year, I thought I was going to quit. And like, let's just quit medicine altogether. I'm going to go back to school and become a teacher, which is something that was always on my mind. I reached out to this person that I felt very comfortable with, and they were like, whoa, slow down. You can teach medical school. You don't have to go back to get a teaching degree. I think that helps. I did it based off of feeling and comfort. When I finally went into residency, same thing. They assign you classmates ahead of you. They try to assign you mentors. But I always found just searching for my own or figuring out who I connect with, that's who I chose to be my mentors.
That's wonderful. That is a question I've had a lot by other students. Like, how do you find mentors? So I'm glad you talked about that. The how important it is to find a connection with someone who gets you that relationship building for the future.
Yeah.
I know you talked a little bit about do you standardized exams before medical school. Did you also have that same experience when you're in medical school with the second exams or clinical?
Absolutely. So yeah, the MCAT is the first step
Mm.
into that whole realm. But yeah, same thing. I did very well on our subject exams that we all do in medical school. And then when it came to the steps, it was just the same thing happens again, where it's learning about your story. I never thought of test anxiety as a disability, but that's definitely what was happening. And I think it really was anxiety, to be honest, that prevented me from excelling on these exams. So for my step one, I did just fine. It just wasn't, if I wanted to be a radiologist or a dermatologist at the time, that wasn't going to happen. But I had a mentor, and this was an assigned mentor for like my last name, right? They do it based off last name. And I actually really liked them. They were a primary care doctor, and I had spoke to them and they said, not all hope is lost. It's fine. At that time, I was already thinking very strongly about primary care. And also at that time, I know now step one is pass fail and step two is more important. For us, it was step one was more important. That was a difficult time for me too, but I was able to get through it and I still became the physician that I wanted to become. So it was just one little blip in the road. And at the time, it felt enormous, like it was something I was never going to get over, but it all worked out.
It's really hard in the moment, especially how much weight they put on those board exams. I'm really glad that you found someone that was able to bring you back to the most important part of medicine. It's not just the score, it's more. And like you said, you got through it and now you've been in the field doing what you love. And that is way in the past. You don't have to think about it. So for now that I bring it up. Are there any other challenges or triumphs in your medical education, residency, and then now career that you would like to talk about and share?
Yeah. So I think in medical school, some of the challenges were being younger than the average age of our students and knowing that a lot of the other students had previous careers before they started medical school and just that self-doubt. Do I belong here? Imposter syndrome. You think that you don't belong here, but you absolutely do. Really downplaying your achievements. I think mindset was the biggest challenge I had in medical school. And then deciding on a specialty. I thought I really wanted to be a neurologist for a long time. And I chose to do my one elective that I had in neurology and then realized, oh my God, this is not for me. And it was disheartening because I was focused on that. And I really thought this is going to be it. So I think that was a challenge. And then eventually realizing that family medicine was the right fit really helped. And then the next challenge was deciding at the time you could only apply to either the MD or the DO match. And you couldn't do both because they had different due dates or deadlines. So then deciding, okay, I'm going to go the MD path just because I liked the programs better and felt like, oh no, I'm going to lose my osteopathic roots, which I did for a little bit. But then when I came out of residency, I started practicing osteopathic manipulation again. So that was a big challenge. And I think some of my triumphs in medical school were really building relationships with people, with my classmates, and not just my classmates, but the different years and the different schools, because there was a pharmacy school. My roommate was a pharmacy student, and just really connecting with people and also like making time for myself, making sure that I fit in something every day that I felt I enjoyed and making sure there was rest between exams or right before exams. I think prioritizing that really helped me. In residency, it was relationships was really important. Like having really good relationship with people I was working with was what really kept me going. And having the right mentorship at the time as an attending, I think I really enjoyed academics. I loved to teach. I was with UCLA after my training there for several years. I only left because I got married and moved to San Diego. And I joined a department that was not academic at the time and really got to focus on patient care and efficiency. I really enjoyed that for a long time. Then COVID happened. I became our COVID lead physician for our department and subsequently burned out from doing all that work and really dealing with COVID in general, which I think everybody has a story about that. And I was able to push through that and I became our clinic medical director. Then I became our department wellness director, which is really fun. We created a whole wellness program and I just loved that work. It was very fulfilling, but the patient volume was rising and I just couldn't see myself being able to keep up with that volume and actually treat my patients the way I wanted to, but also be able to balance that with a leadership role. That's about the time when I actually found a physician coach and they really helped me be the best leader I could be at the time. They helped me realize that I didn't want to leave medicine. I just needed a different way to practice. They gave me the courage to tell my boss that I was burnt out, which was really hard for me because there's just so much. I think I was judging myself for being burnt out, a lot of embarrassment, really trying to manage like what part of this was I responsible for versus the system was responsible for. and ultimately really taking ownership for my part because that's the only thing that I can control. So being able to talk to them, was able to go part-time, and then I wasn't allowed to stay part-time just based off our department structure. So making the decision to resign and go somewhere else, and then last minute, there was a position that became available in our concierge medicine department, and my boss really felt that this was a good fit for me. This is the way that I would want to practice medicine. I am very lucky to have always had a very good relationship with my boss. And it goes to show why it's important to have good relationships with the people you work with. And so I ended up deciding, okay, I interviewed for the concierge position and I never thought in a million years I would do concierge medicine. But it really was the way for me to stay and enjoy medicine. Not for everybody, but for me, it was really important to have more time with my patients and have the right staff support. And those two things I've found in my current practice. So that's what led me to concierge medicine. And then because I burnt out and had a coach that helped, I certified as a coach. And that's why I started coaching students and primary care physicians is my goal to focus on primary care physicians because I think primary care versus specialty care, we have a lot of the same challenges, but primary care it's a very specific type of challenge. I can really speak to that because I've experienced that. But I think through the whole journey, just learning the importance of teamwork, the importance of recognizing when you're burnt out, going about asking for help, and then figuring out, okay, now that I've asked for help, how do I move forward? And really the power of social media and building communities. This is the first time I've seen physicians from all different specialties coming together versus trying to be all these separate to be so separate. I feel like we've really come together and we've made a lot of progress. There's a lot to be done, but we've made so much progress towards the wellness of our physicians and our students.
Thank you. You shared so many things that I wish I could be here for so much longer to dive in. You burnout is huge in medicine right now in wellness. And I love how you talked about that you were able to recognize that not all of it was you, part of it was the system, but then also take ownership and tell others and tell someone else that you're struggling. How did that conversation go for other individuals who are experiencing that burnout and maybe are fearful of losing their work if they actually verbalize it? What kind of thoughts that maybe the coach gave you or your recommendations?
Yeah, it's a great question. The first thing is I always had a supportive boss, and I got to know him very well because I was in these different leadership positions and meeting with him pretty frequently. That's one thing is if you have a good relationship with the person, it makes it a lot easier. If you don't, I understand that's going to be a little harder. If you don't, then it's going to someone, maybe someone else within the department that you feel comfortable speaking to. That might be a good first step. The second part of it is realizing that if you never ask for what you want, you'll never know if you'll get it. So the worst thing that someone can say to you is no. And I believe that every student or physician, anybody going into medicine is very resourceful. You did not get to where you are without being resourceful. And before actually going into a meeting, one, laying out what's the worst case scenario, what's the best case scenario, and then also coming with a solution. A lot of the time, people think, oh, they're just complaining about being burnt out or complaining about something. But if you come with a solution, there's no room for people to say, you're just complaining. Right? Because a lot of the times, you know what the solution is. I need to go part time, or I need to be promoted, or I need more time to do this project, whatever it may be. A lot of times, the solution, but you're afraid to even say that. I think it's important that you do. So, yes, knowing that they might say no, and that's okay. You'll find another path and having some kind of solution and seeing how they can work around it with you. Like for me, I actually was able to go way more part-time than I expected they would give me. So I asked for just a little and they were actually able to give me a lot more and I did not expect that. So just keeping in mind that the best case scenario could happen. And I was able to stay in my leadership position because I asked for that. I said, hey, this is what brings me fulfillment. Can I do both things? And I was able to for that period of time. And then after the fact, just knowing, like, just getting to that first step really allows you to then say no to more things when it's too much, like setting your boundaries. But it also allows you to, the next time you need something, the next time you want to ask for something, you're less afraid to do that because you build this whole thing up in your mind like it's going to be terrible. It very well be just fine. And even the worst case scenario, you'll be just fine. Think about it. If you go to your boss and you tell them this and they fire you, that, yeah, that's something terrible. That's something that's going to be really hard for you to take. But you're a physician and we need physicians. So you can very easily find another job, right? It might not be the perfect job for you to begin with, but you're not just going to be left without a job for very long, especially after the pandemic. So that would be like, for some people, that's the worst case scenario. So that's why I bring it up. But doing that and then also helping your peers, because I'm sure once you speak up, like once I spoke up and I was resigning, there were a lot of people after that that were like, I need to go part time. There were people that they were trying to fill some of my role. And I recommended certain people. I spoke to a lot of them and them asking me, like, why did you burn out? What happened? What should I ask for? That sort of thing. And just explaining, again, like me taking responsibility for my part, but this is how it could have been better. This is what I would talk about at least with the supervisors. It's like a ripple effect. Like you never know like what you do, how it will affect other people in a good way. So that was my journey into that specific discussion of I'm burnt out. I need to go part-time. How am I going to sustain this?
Thank you so much. Exactly what you said. Speaking up does create waves, and it just takes that one person to be vulnerable, and it can really impact all those people that are struggling silently and can really change the culture. So that's amazing that you were able to do that and help out your team and also yourself. I was thinking about when you were talking about needs and being able to express your needs. And especially for this podcast, where we're talking about individuals who are suffering with disabilities or health conditions or mental health conditions, including burnout. I feel like that is a very common question that people talk about is like, how do I ask for accommodations? How do I ask for help? Because especially females and then females of color, we don't want to be complaining. We don't want to be seen as lesser than our colleagues. So it's so healing to hear your story and hear the success that you were able to express your needs and ask for your needs, and they didn't just ignore you or kick you to the curb. Like they actually
Yeah.
worked with you and worked with other individuals. I can tell the coach in you is coming out and the great advice you're getting. And it made me wanted to ask you if you can explain to people on the podcast the difference between a coach, mentor, and advisor. Like, what makes a coach different? Because I've heard these words come up at conferences, like a 5-minute or 30-minute coach, like at different conferences. And I'd always had good experiences, but I really want to know what is the difference. And I'm sure other people too would love to hear.
Yeah, that's a great question. I'll start with a mentor. We all have mentors throughout our life. And if we're thinking about mentorship is usually someone who's finding somebody that's in your field that has similar goals and working with them for advice. And it's very development driven. When we talk about coaching, it's also goal oriented, but very collaborative. It's not necessarily me telling you what to do. It's me showing you that you have the answer. How do we draw out the answer from you? And what is it that you want? Really helping you create, we say mindset is a big barrier for most people. It's like, how do you create a belief system that really serves you? And coaches, they don't have to be in your profession. They can still coach you through something because it's more universal. I think it helps when your coach has a similar experience as you, but it doesn't have to be. And then the third arm is therapy, because that is another question that people ask. In therapy, you have to be licensed within your state to actually treat people. And it's very emotion focused and looking at your past, like what happened in your past that's happening to you today. So that's the differences between all three of them. And because I work with students as well, I do a lot of mentoring and coaching, which, it's just natural that's going to happen. But I always tell students the difference because with students, it's always, am I doing it right or am I saying the right thing? And to me, that doesn't matter. Your feelings are not wrong. Your feelings can never be wrong. I'm not here to tell you what's right or wrong. I'm here to tell you, what do you want to believe? How are you going to go from thinking about things in a way that doesn't serve you to a way that does? And with mentorship, there's very much, yes, you should do this and that to get to become a family doctor, for example. So that's the difference, but I combine the two just because, especially with students, because it's just a natural thing that happens and I want to meet them where they are.
That's really helpful. Thank you. I can see also the reason why you went into primary care because that is, I'm sure in concierge medicine, you're able to do that also with patients, having that collaborative nature of working, helping them develop their own strategies, whether if that's stop smoking or eating healthier, but it's very much a collaborative. You come up with the answer, but I'm here to provide other solutions. We forgot to talk about the concierge medicine. I know you mentioned that you did it. It's becoming more common in the medical field. Is there anything that you would like to share with future medical students or even providers that have not considered concierge medicine, but are maybe looking at that direction?
Absolutely. My view of concierge medicine was always negative. It's celebrity medicine, it's for rich people, that whole thing. But when it came time to figure out how can we practice medicine better, I started to look at it in a different way. So concierge medicine, you take insurance, then you charge. It's usually a yearly fee to have access to your physician or to certain services. Certain concierge practices also offer like home visits or going to the ER when you do, or seeing you in the hospital. It just depends on what practice you have. So you can do whatever you feel is appropriate. And for me, I'm part of a big university. So it's not my own practice, it's not my own business, which for me, it has a lot of benefits because being connected to a big university, you have a lot of great specialists and you're not dealing necessarily with all the business aspects. But I know plenty of people that start their own concierge practices. And because they have that, they get to build what they want. They have that autonomy, that freedom, flexibility. And I think that's also very important. You can do that without a business degree or without business experience. I know plenty of physicians that have done that. So, concierge medicine, the biggest thing I think is just having time with your patients. In my particular clinic, we get 2 hours with new patients, 1 hour for follow up patients. We have small patient panel sizes. For me, I'm considered part time. So, I'm about 200 patients total versus I have friends who are full-time physicians in outpatient clinics that are like 3,000 patients total. Like, how can you even keep track? So having the small sizes really allows you to know your patients very well. And then we have support from our advanced practice providers, which previously I had never really worked closely with them, but we have an amazing team of providers who see patients for urgent visits. They help with all of our messaging and refills, and it's a very collaborative environment, a great team environment. And that's just my practice. Every practice is different, but those are the things that have really helped me enjoy practicing medicine is mostly it's like the time and the support. Then there's like direct primary care, which is there's a whole movement of direct primary care, which is basically cash only practices. Most of them do not take insurance, but they have tiers. It's more affordable. It's the same thing where you have really good access to your providers, which access is a huge problem, as I'm sure you've seen. It's just the pandemic really changed things. So having access to your physician has become so important. So that's where concierge medicine comes into play. We have direct primary care. And again, there's so many different ways to join these practices. And if you want to start your own business, there's so many ways that people are being supported now of that. Private practice has come back, which is usually like a hybrid, but usually private practices take all kinds of insurance. So just for students and physicians who think that, oh, there's only clinic or hospital work, just knowing that, I mean, those are the big categories, but there's so many ways you can do that. and don't limit yourself because you don't think you have the education to do those things. Again, we're physicians, we're very resourceful. Think about all the hard things you've done before. This is the same, or if not the same, it's actually easier to learn about those things. So just knowing that if you're looking into practicing medicine as an outpatient physician, there's just so many ways that you can do it.
Thank you. That was really helpful. We have another physician that I just interviewed on direct primary care, so this will be really good. They are similar, and I think the motivation's the same, is we want to provide better care for our patients and actually get to know our patients, actually spend time with them. That's why we went into medicine. And you know what? Earlier, you mentioned something about the reason that you wanted to do primary care and neurology. You mentioned chronic pain. Did, do you want to say more of that? Different unique perspectives that you bring into primary care.
Essential family through their lifespan. I find that very rewarding and to be able to help them as this unit individually, but also as a unit. And then really having the flexibility to practice medicine in so many different ways. And you're like the jack of all trades, or as a female, I call it the Jackie of all trades, right? When you're a primary care doctor, you're like the gateway to medicine. So really helping put people on the right path, being very preventative. And I think as primary care, essentially, I feel like we are also psychiatrists in a way or therapists in a way because most people that I've seen as a physician have experienced anxiety or depression at some point in their life, and being able to be a resource for them, especially with mental health access being at an all-time low, and that's getting better too, but it's hard. Just being able to provide quote unquote therapy for your patients because they're going through this process. I think becoming a coach has helped me a lot, not only in my own personal life, but actually help patients through the issues that they're going through. And then, yes, the osteopathic piece, I came back to that and I'm really happy that I did. I really came back to it when I came to UCSD because they're very supportive of osteopathic medicine. They have an integrative health center and being able to help patients with chronic pain conditions. There's a lot of other things you can help with, but my focus has been chronic pain conditions through the manual therapy, like to be able to help them in that way and not just throwing medication at them, which medication, of course, can be a very important component to it, but just having this extra thing to help them. And when you actually treat people with osteopathy, you're spending an hour with them. And it's also almost like a therapy session for them as well, because you're talking about all the things going on in their life. That piece, like being able to talk about how you feel, but also being treated for your pain. We all know mind and body are very connected. I think both of those things together is what's really helping these patients that I'm treating, not just the physical part of it.
I love that. That is definitely one of my goals. Even though I didn't go the DO route, I'd gone to conferences where I've learned osteopathic techniques, and I'm very interested in the mind-body connection for that reason, because physical touch is so important just for the human experience and just recognizing, like you said, the way the mind works and the body, there's a connection there. Medicine is not the only thing. There's so many other paths for treatment and for healing. As we finish off, is there any last tidbits that we didn't mention that you would like to share with the podcast?
Yeah. So I just, for really anyone that's listening, just remembering one, don't be afraid to ask for help because the longer you wait, the worse it gets. And so just ask for help in whatever way you can, whether it's your family, your friends, your colleagues, your boss, whoever it may be. If you're starting to notice that you're having problems or concerns, it's really important that you do that ahead of time. I think remembering that you're on your own path and not comparing yourself to other people. If you are comparing yourself to other people, it should be about looking at how are they successful in this realm? What were the habits that they create to be successful? I think that's really important. And then not believing in this, what we call the arrival fallacy, which is thinking that once I become a doctor or once I become a clinic director, or once I become whatever it may be, what your goal is, then I'll be happy. That just doesn't happen. And I think as a student, even as a medical student, you know that because once you got into medical school, it's like, oh, you were so excited, but then there was something else, and the next thing, and the next thing. So just really trying to enjoy your journey, really trying to find all the opportunities, any challenges that you're facing, I think is really important. And then just knowing that all you have to do is take the next best step. You don't have to think hundreds of steps in advance. It's just the next step forward. And I think that's important to keep in mind when you're going through something that's very difficult.
Thank you so much. Would you like to share your social media and how else individuals can get in contact with you? And I'll also link it below.
Yeah, sure. So, best way to get in touch with me is through my website. So it's www.borsisphysiciancoaching.com. On there, there's a contact form. You can send me an email. There's a lot of free workbooks and worksheets that we may want to look into that may be helpful. And then all my social media platforms are on there. I primarily do use LinkedIn, but I know with students, you're all across the board. So I'm also on Instagram and Facebook and Twitter. Any way you want to contact me, but if you go to my website, everything's on there.
Wonderful. Thank you. I'll make sure to include that website so people can get in contact with you to get more information. I'm sure you do coaching that people can sign up for. And I'll make sure to include that. And I want to thank you, Dr. Borad, so much for joining. And then also everyone who joined today. We talked about burnout prevention, mentorship, coaching, teamwork. Recognize how you can go to a different type of medicine that maybe is more in line with what you believe. And I want to thank Dr. Borad for sharing her experience and the lessons that she's learned throughout her journey. Something that I love to share is know that you're not alone. Dr. Borad is an example that you can struggle in school, you can struggle as a resident, you can struggle as an attending, and it's okay. You will get through it. You just need to ask for help. It's so important to remember that you're not alone and that you don't need to give up. There are so many people out there rooting for you. If you haven't already, please follow and subscribe, whether you're listening on YouTube, Spotify, Apple. Make sure you click subscribe and look at all the other interviews. We are interviewing physicians, residents, attending nurses, a lot of individuals throughout the healthcare field that have experienced challenges of living life in addition to being healthcare providers and seeing how that impacts their job. It's so important to remember that we're all humans too. So make sure you follow and subscribe. You can contact me on my website, MedPsychMoss, on any and all social media at MedPsychMoss. Thank you again, Dr. Borad. See everyone in the next podcast.
Thank you. Thank you so much for having me.